Kia ora, I'm Dr. Rebecca Garland.
This is a video that will explain the basics about cholesteatoma, which is a common ear problem that ear doctors often see. So to begin with, what is cholesteatoma?
Well, that's a good question. Cholesteatoma is a collection of skin. There's already skin in your ear, on the eardrum, and cholesteatoma is when the skin gets trapped in a different part of the ear and starts to form infections.
Okay, and how does it exactly form?
There are two main ways that it can form. It depends on what part of the eardrum is affected. So this main part of the eardrum here is where people who have lots of problems with a tube that pops and clicks their ears, we call that the eustachian tube, that is sometimes blocked and the eardrum can become sucked in. That becomes a bit like a shrink-wrapped ear, so that, you know, when you have vegetables in the microwave and you put plastic on it and then it sucks in, and the skin of the ear then becomes trapped in all the nooks and crannies where it's been sucked in. Other people, rather than this main part of the eardrum, have the top part of the eardrum, which is thinner than the other parts of the eardrum, become sucked in, and it is similar in that it's probably problems with this tube to pop and click the ear, forming a vacuum. Then that vacuum means that the skin of the eardrum is pulled in almost like a deflated balloon. Once the skin gets trapped in that balloon part, it then grows and grows and gets bigger and bigger into other parts of the ear.
Okay, so you mentioned that some people will have tubes that don't work quite well, like click a bit more. Why do some people get them and not others?
That's a question I wish I knew the answer to. Unfortunately, no one really knows the answer to that. Some people do have problems with infections in the back of the nose and in the ear. Sometimes it could be related to things like nasal problems, like allergy, that can coexist with cholesteatoma, but other times people have no risk factors. Some things that we can control are things like smoking. So smoking can damage the delicate linings of the tube and the area around it, and that poisons the little hairs that help to shift the mucus. So things like stopping smoking can help, but cholesteatoma also occurs in people who don't smoke.
Okay, and if someone did get a cholesteatoma, what are the kinds of things that they would experience?
Yeah, so that's a good question. Often people don't notice that they've got a cholesteatoma, and that can make it really hard to diagnose, particularly for people in general practice or ear health clinics. The hallmarks of it, or the things that commonly present, are leaking from the ear, so people getting infections. Sometimes they're painful infections and sometimes they're painless, and mucky discharge or runny stuff comes out the ears, can be a bit smelly. Those infections are, once that skin's trapped, those infections form from the skin getting trapped and maybe some water getting in and making that skin soggy and then causing an infection. So sometimes the infection might clear up with some drops or antibiotics, but the underlying problem of the skin is still trapped there. So then sometimes the infection can come back again. Otherwise, other people don't get infections and they just notice hearing loss. One of the things as the cholesteatoma goes in is it can damage the little delicate hearing bones, and that can cause a hearing loss. So for some people, the first thing that they noticed is hearing loss in their ear.
Okay, so it's trapped skin, and it can cause infections, it can cause some hearing loss, and it can cause some mucky discharge. But why do we worry about cholesteatoma?
Yeah. Well, I mean, obviously none of those things are very fun to have, and my patients often find that the discharge is a really unpleasant thing to have. It can cause disharmony when people don't like to smell. I mean, I don't think anyone really likes that. No. So often there are symptom-based reasons, but there are some other more serious things that can happen if cholesteatoma is not treated. Cholesteatoma can affect the little hearing bones, which we've mentioned, and that can be a permanent effect, so that the damage might not be able to be repaired or have to be repaired by a replacement. In addition, there is a nerve that goes through the ear that supplies movement of the face. If that nerve is damaged, it's called the facial nerve, and like its name, you can tell that it moves the muscles of the face. Damage to that nerve can mean that the face might droop. So an important thing to watch out for in cholesteatoma is if the face starts to droop. We mentioned before that once the skin's trapped in here, then it can't empty. If we imagine the deflated balloon, the neck of the balloon is much tighter than the whole part of the balloon behind. So the drainage can't go through the smaller neck of the area where the cholesteatoma is trapped. And that means, like a balloon, it keeps expanding and expanding. And as it goes, very slowly over time, it starts to eat away at other structures. So if we look in here, and take this part here off, we can see that behind the eardrum are the little hearing bones, which we've already talked about can be affected. And there are other parts of the inner ear, a nerve that supplies movement of the face, and the part that I removed here is the top, and we can see that on the other side of that is the brain and its linings. So untreated cholesteatoma can not only cause those symptoms, but can spread to other parts of the body. Well, nearby.
Yeah. Okay. And so if left untreated, so what are our treatment options for cholesteatoma?
Yeah, so of course treating any infections is helpful, and preventing infections by keeping the ear dry. So that's the first step, to make sure that the infection is treated. But the cholesteatoma won't go away with just treating the infections, and that's a really important thing to understand, because sometimes patients might feel that once the cholesteatoma is treated with the antibiotics or drops, that they haven't got any problems, but the infections will keep coming back. The only real cure for cholesteatoma is surgery, so it needs to be removed.
Thank you, Dr. Garland, for explaining the basics of cholesteatoma to us, and thank you for watching the video. Cholesteatoma is a complicated condition, but hopefully we've explained some of the basics to you here today. If you have any questions, please ask your ear doctor for any further clarifications, and they'll be happy to help you. We will wish you all the best with your treatment journey.
Ngā mihi nui.